Hello everyone, welcome to my video channel. Today I am going to cover regarding synovial joint. I will start off with an introduction, joint classification, structural features of synovial joint. The types of synovial joint include ball and socket joint, hinge joint, condyloid joint, saddle joint, pivot joint, and lastly regarding the plane joint. Now let's get started. As an introduction, the anatomical definition of a joint. Articulation is the location where the two or more bones or any rigid parts of the skeleton connect with each other. It forms a mechanical support to the skeleton and allows a variety of movement in different range between the skeletal elements. Some joints, such as sutures between the cranial bones, allow very little or all to no movement. Other joints, such as the shoulder and hip joints, allow free movement in a large range. For joint classification, joint differs from each other by their tissue formation, function, structure, and movement. For A, types of joint by tissue formation, when the articulating bones are connected, the connection may mainly involve three types of tissue: fibrous tissue, cartilage tissue, or synovial membrane. For fibrous joint, it is united by dense connective fibers such as sutures between the cranial bones, the interosseous membrane in the forearm, and the socket articulation between the root of the tooth and the alveolar processes of the maxilla and the mandible. The interosseous membrane allows movement between the two articulating bones. This type of fibrous joint is classified as syndesmosis. The root of the tooth and its alveolar process is similar as to how cone-shaped peg fits into a socket. There is little room to move in this type of joint, which is defined as kyphosis. This picture shows an example of interosseous membrane that located in between the tibia and fibula bone. Regarding a cartilaginous joints, these joints have cartilage in between articulating bones to form a cartilaginous plate or disc. Example of a primary cartilaginous joint is the epiphyseal plate of a long bone, which disappears after puberty. Example of a secondary cartilaginous joint is the intervertebral disc between each vertebrae. This picture illustrates the primary cartilaginous joint, epiphyseal plate or growth plate that disappear after growth is achieved. Regarding synovial joint, it is also known as a diatrodial joint, and it is formed by three basic components: the joint cavity, the joint itself, articular cartilage, which cover the surface of the articulating bones, and the joint cord capsule, which is composed of a synovial membrane layer lining up the joint cavity and a fibrous layer outside the synovial membrane. A synovial joint may have a ligaments that form a portion of the fibrous joint capsule or ligaments that exist inside the joint capsule. Cartilaginous discs, such as menisci in the knee joint, may be found in the joint cavity. This picture shows the knee joint, which is covered by synovial membrane, with inside contain a synovial fluid and cartilage. B. Types of joint by tissue formation and mobility. Number 1. Synastrosis joint is a fibrous type of joint that allows very little or no movement under normal condition. If a joint is formed with an intervening tissue, fibrous connective tissue, cartilage, or bone in between the two joint forming elements, it is a synastrosis joint. This joint usually has limited mobility. Suture joints between the cranial bones and gomphosis are synastrosis joint. Number 2, diarthrosis joint. There is a joint space in between the two joint forming elements. Example, synovial joints. Number 3, synostosis joint. It is defined when two bones fuse with each other under normal or abnormal conditions. Normally, cranial bone fuse together when a child reaches adulthood, or when the diaphysis and epiphysis fuses in puberty. Abnormal fusion of bones may occur too early in development, such as early fusion of cranial bones, craniostenosis, or when bones are abnormally joined together, such as the synostosis of the cervical vertebrae. Number 4, syndesmosis joint. Fibrous joint containing either an interosseous membrane or a ligament that allows movement. Example, distal tibiofibular joint. 5. Synchondrous joint. A cartilaginous joint containing a hyaline cartilage in between the two joint bone. Example, the primary cartilaginous joint with an epiphyseal plate between the epiphysis and the diaphysis of the long bone, and the joint between the first rib and the sternum, not including any other ribs. However, the intervertebral discs are not considered synchondrosis because they are composed of fibrous cartilage. They, along with the joint between the pubic bones, are referred to as symphysis joint. C. Types of joint categorized by structure and movement. There are 6 types of synovial joints that allow the body to move in a variety of ways. A. Pivot joint allows for rotation around an axis, such as between the first and second cervical vertebrae, which allows for side-to-side rotation of the head. B. Ball and socket joint. Example, the hip and shoulder joint. This picture shows an example of a pivot joint and ball and socket joint. C. Hinge joint of the elbow works like a door hinge. D. Saddle joint. The articulation between the trapezium, carpal bone and the first metacarpal bone at the base of the thumb. This picture illustrates the hinge type of joint and saddle joint. E. The condyloid joint. Example, the radiocarpal joint of the wrist. F. A plane joint. Example, between the tarsal bone of the foot, allowing gliding movement between the bones. This picture shows the condyloid joint between movement that occur in between radius and carpal bones of the wrist and the plane joint in between the tarsal bone. A. Regarding a pivot joint. At a pivot joint, a rounded portion of a bone is enclosed within a ring formed partially by the articulation with another bone and partially by a ligament. The bone rotates within this ring. Since the rotation is around a single axis, pivot joints are functionally classified as a uniaxial diatherosis type of joint. Example, atlantoaxial joint found between the C1 atlas and C2 axis vertebrae. The second pivot is at the proximal radial ulnar joint, PRUJ. The head of radius is encircled by a ligament that holds it in place as it articulates with the radial notch of the ulna. This picture illustrates the atlantoaxial joints as a pivot type joint. B. Regarding the ball and socket joint, it is a joint with the greatest range of movement. At this joint, the rounded head of bone, the ball, fits into the concave circulation, the socket, of the adjacent bone. Example, the hip joint and the shoulder joint. Ball and socket joints are classified functionally as multi-axial joints. The femur and the humerus are able to move in both anterior posterior and medial lateral directions. This picture shows the hip joint as an example of ball and socket joint. The femur and the humerus can also rotate around their long axis. The shallow socket formed by the glenoid cavity allows the shoulder joint an extensive range of movement. In contrast, the deep socket of the acetabulum and the strong supporting ligaments of the hip joint serve to constrain the movements of the femur, reflecting the need for stability and weight-bearing ability at the hip. This picture shows the shoulder joint anatomy. C. Regarding the hinge joint. In a hinge joint, the convex end of one bone articulates with the concave ends of the adjoining bone. This type of joint allows only for bending and strengthening motion along a single axis, and thus classified as uniaxial joint. Example, elbow joint, with the articulation between the trochlea of the humerus and the trochlear notch of the ulna. Other hinge joints of the body include knee, ankle, and interphalangeal joint between the phalanx bones of the fingers and toes. This picture shows the elbow joint as a hinge type joint. D. Regarding the saddle joint. Both of the articulating surfaces for the bones have a saddle shape, which is concave in one direction and convex in the other. This allows the two bones to fit together like a rider sitting on a saddle. Saddle joints are biaxial joints. Primary example is the first carpo-metacarpal joint between the trapezium, a carpal bone, and the first metacarpal bone at the base of the thumb. This joint provides the thumb the ability to move away from the palm of the hand along the two planes. Another example is the sternoclavicular joint. This picture illustrates the carpo-metacarpal joint as a saddle type of joint. E. Regarding condyloid joint or ellipsoid joint. The shallow depression at the end of one bone articulates with a rounded structure from an adjacent bone or bones. Example, the knuckle, metacarpophalangeal joint of the hand between the distal end of a metacarpal bone and the proximal phalanx. Radiocarpal joint of the wrist, between the shallow depression at the distal end of the radius bone and the rounded scaphoid, lunate, and triquetrum carpal bones. In this case, the articulation area has a more oval or elliptical shape. It is a biaxial joint that allows for two planes of movement. One movement involves the bending and straightening of the fingers or the anterior-posterior movement of the hand. The second movement is side-to-side movement. This picture illustrates the metacarpophalangeal joint as a condyloid type of joint. And finally, F regarding the plane joint, or also known as gliding joint. The articulating surfaces of the bone are flat or slightly curved and of approximately the same size, which allow the bone to slide against each other. The motion is usually small and tightly constrained by surrounding ligaments. Based only on their shape, plane joints can allow multiple movements, including rotation. Plane joints are functionally classified as multi-axial joints. However, not all of these movements are available to every plane joint due to limitations placed on it by ligaments or neighboring bones. Depending on the specific joint of the body, a plane joint may exhibit only a single type of movement or several movements. Example, between the carpal bone or intercarpal joints of the wrist or tarsal bone, intertarsal joints of the foot, between the clavicle and acromion of the scapula, ACJ, acromioclavicular joint, and between the superior and inferior articular processes of adjacent vertebrae, zygapophyseal joint. This picture illustrates the acromioclavicular joint as a plane type of joint. Yay! We have reached to the end of the video. I hope you have learned something from this video. See you in the next one. Take care and bye.